Dementia is a term we hear often, but what does it really mean? It is not a specific disease. Instead, it is a general term for the loss of memory, language, problem-solving, and other thinking abilities that are severe enough to interfere with daily life. Think of it as an umbrella term that covers a wide range of specific medical conditions, including Alzheimer's disease. While many people associate memory loss with getting older, it is crucial to understand a very important fact. Dementia is not a normal part of aging. Minor memory slips can happen to anyone at any age, but the kind of cognitive decline seen in dementia is caused by damage to brain cells. This damage affects the ability of brain cells to communicate with each other. When these cells cannot communicate normally, thinking, behavior, and feelings can be affected in very serious ways. Different types of dementia are associated with particular types of brain cell damage in specific regions of the brain. For example, in Alzheimer's disease, high levels of certain proteins inside and outside brain cells make it hard for those cells to stay healthy and to connect with each other. This is a physical change in the brain, a disease process that goes far beyond the simple forgetfulness that might come with age. It changes a person's ability to function independently. For seniors, distinguishing between normal age-related changes and the early signs of dementia is essential for getting timely help. Normal aging might mean occasionally forgetting an appointment or a name, but remembering it later. It might mean making an occasional error when balancing a checkbook. In contrast, dementia might involve forgetting the names of close family members, getting lost in a familiar neighborhood, or being unable to follow a simple recipe. It is a persistent decline that affects multiple aspects of a person's mental function, not just isolated incidents of forgetfulness. Recognizing this difference is the first step toward understanding and addressing the problem. It is a common myth that once you reach a certain age, your mental abilities will inevitably decline into dementia. This is simply not true. Your brain is a powerful organ, and there are many things you can do throughout your life to protect it. Understanding that dementia is a medical condition, not a certainty of old age, empowers us to take action. It allows us to look at the risk factors, such as genetics, lifestyle, and importantly, substance use. By learning about these factors, seniors and their families can make informed choices to promote long-term brain health and well-being, preserving cognitive function for as long as possible. Our brains are incredibly complex and, unfortunately, vulnerable to harm from various substances, including alcohol and certain drugs. As we age, our bodies process these substances differently. Our metabolism slows down, and our brains can become more sensitive to their effects. This means that a level of alcohol or a dose of medication that might have been fine in our younger years can have a much more powerful and potentially damaging impact later in life. This increased sensitivity puts seniors at a higher risk for cognitive problems related to substance use, making it a critical topic for older adults and their families to understand fully. Alcohol, for instance, can be directly toxic to brain cells. Heavy or long-term drinking can lead to brain shrinkage, particularly in areas responsible for memory and higher-level thinking. It can also cause vitamin deficiencies, especially a lack of thiamine, vitamin B1, which is vital for proper brain function. Without enough thiamine, brain cells cannot produce the energy they need to work correctly, leading to significant damage. This is not just a temporary effect that wears off. Over time, this damage can become permanent and lead to a form of dementia. It is a clear example of how a lifestyle choice can directly impact the physical structure and health of the brain. It is not only illegal drugs that pose a threat. Many common prescription and over-the-counter medications can also affect cognition in older adults. Medications like certain sleeping pills, anti-anxiety drugs, benzodiazepines, and some allergy medicines, antihistamines, can cause confusion, memory loss, and a lack of coordination. When used over a long period, or when multiple medications are combined without careful medical supervision, the risk of developing dementia-like symptoms increases. This is often referred to as substance-induced dementia. The good news is that in some cases, if the substance use is stopped, the cognitive symptoms may improve or even be reversed. The key takeaway here is that what you put into your body has a direct impact on your brain's health, especially as you get older. The aging brain has less resilience, meaning it does not bounce back from injury as easily as a younger brain might. Therefore, being mindful of alcohol consumption and carefully managing medications with a doctor's guidance are crucial steps. Understanding these risks is not about creating fear, but about providing the knowledge needed to make safe and healthy choices. It's about being proactive in protecting one of our most valuable assets, our minds. When we talk specifically about alcohol's impact on the brain, we often refer to alcohol-related dementia, ARD. This condition is a form of dementia caused by excessive long-term alcohol consumption. The symptoms of ARD can look very similar to other types of dementia, like Alzheimer's. They can include severe memory problems, difficulty with planning and making decisions, and changes in personality and behavior. For example, a person with ARD might struggle to manage their finances or have trouble controlling their impulses. These symptoms develop because alcohol has been damaging brain cells over many years, leading to a decline that affects every aspect of a person's life. One of the most severe conditions linked to alcohol use is Wernicke-Korsakoff syndrome, WKS. This is actually two separate conditions that often occur together. Wernicke's encephalopathy is the acute phase and is a medical emergency caused by a severe thiamine deficiency. Symptoms include confusion, loss of muscle coordination, ataxia, and abnormal eye movements. If it is not treated immediately with high-dose thiamine injections, it can lead to permanent brain damage or even death. This stage highlights the critical importance of thiamine for brain survival and function, a connection that is directly broken by chronic alcohol abuse. If Wernicke's encephalopathy is not treated promptly, it often progresses to Korsakoff syndrome, which is the chronic and long-term memory disorder. People with Korsakoff syndrome have profound difficulty forming new memories. They might have a conversation and forget it completely just minutes later. A hallmark symptom is confabulation, where the person invents stories to fill in gaps in their memory, but they are not intentionally lying. Their brain is simply trying to make sense of the world with fragmented information. They may also struggle to retrieve old memories accurately. This condition demonstrates the devastating and permanent damage alcohol can inflict on the brain's memory centers. It is important to know that not everyone who drinks heavily will develop ARD or WKS, but the risk is significantly higher. The damage is often related to the combination of alcohol's direct toxic effects and the nutritional deficiencies it causes. For seniors, whose bodies are already undergoing changes, the risk can be even greater. Recognizing the signs of heavy drinking and seeking help early is the most effective way to prevent these life-altering conditions. Understanding the serious nature of alcohol-related brain damage is a powerful motivator for both individuals and families to address alcohol misuse. The information about dementia and substance use can seem daunting, but there is a message of hope. A great deal of this damage is preventable. The most important step you can take to protect your brain from substance-related harm is to be mindful of your alcohol and medication use. For alcohol, moderation is key. Current guidelines often suggest no more than 1 drink per day for women and no more than 2 drinks per day for men, with even lower limits recommended for all adults over 65. If you have a history of heavy drinking, the safest choice is to stop completely. It is never too late to quit or cut back. When it comes to medications, maintaining an open and honest dialogue with your healthcare provider is essential. Keep an updated list of all the medications you take, including prescriptions, over-the-counter drugs, and herbal supplements. Regularly review this list with your doctor or pharmacist. Ask questions like, is this medication still necessary? Or, could this drug be affecting my memory? This practice, often called a brown bag review, where you bring all your medications to an appointment, can help identify potential drug interactions or side effects that could be harming your cognition. Being an active partner in your healthcare is a powerful protective measure. If you or a loved one is struggling with substance use, please know that support is available. You are not alone. Talking to a trusted doctor is a great first step. They can provide guidance and connect you with resources like counselors, support groups such as Alcoholics Anonymous, or treatment programs designed specifically for seniors. Family members can play a supportive role by expressing their concerns with love and compassion, avoiding judgment, and encouraging the individual to seek professional help. Early intervention can make a significant difference in preventing further cognitive decline and in some cases may even help reverse some of the symptoms. Ultimately, protecting your brain health is a lifelong journey. In addition to managing substance use, staying physically active, eating a balanced diet rich in vitamins, engaging in social activities, and keeping your mind challenged are all proven ways to support cognitive function. Your brain has a remarkable ability to adapt and heal, but it needs your help. By making conscious, healthy choices today, you are investing in a sharper, healthier mind for all your tomorrows. Take these steps to cherish and protect your cognitive health. It is one of the most precious gifts you have.